few remarks, and then I'll take any questions that folks have. Well, here we are. Doug Ford basically marched us into another lockdown with eyes wide open. And I have to say I was shocked to hear the Premier blame Ontarians. Meanwhile, experts warned him very clearly that this is exactly where we were headed. He ignored them and walked us straight into danger. And what does that mean? People who have been working so hard to do their best are now stuck in this situation. They're suffering. People are frustrated. They're worried about the future. They're having a hard time hanging on. Small businesses continue to close because the government simply hasn't been there to support them. Today's approach is basically more of the same failed approach that we've been through already. It's a too little, too late response by this government to what we knew was coming. The variants of concern, the speed at which they spread, the overwhelming of our hospitals, healthcare system. This is exactly what the experts warned of back in February, when Doug Ford basically said things were looking rosy. I'm worried that this approach, this failed approach, is going to fail us again. What we know is that the public health measures that this government has announced are not what experts are calling for. They fall short of what experts have been calling for, what they were calling for back in February, what they were calling for in the second wave. Things like paid sick days for essential workers, for all workers, but particularly essential workers, where the virus is spreading. Once again, we have mixed messages in this announcement today. We didn't hear anything about paid time off for vaccinations, nothing about extra financial supports for businesses that I'm sure are reeling again with today's announcement. No cap on class sizes or other measures to keep our schools safe. No strategies to get vaccines into the arms of our essential frontline workers. This is yet again a lockdown that Doug Ford brought to Ontario. It's Doug Ford's lockdown, and I really want to say to people, keep doing your best. It's not your fault. The government hasn't provided the necessary leadership to prevent us from getting to exactly where the experts warned we were going to be. On that note, I'll take any questions that folks might have.
As a reminder, if you have any questions, please press star one. First question from Jack Cowan at Queen's Park Briefing. Please go ahead.
Hi, Andrea. The Premier mentions that the Cabinet meeting last night went for 8 or 9 hours. If he's saying that he's listening to experts, is it concerning that there's that much debate over what to do?
Well, I mean, I can't imagine why this government continues to have these political discussions when the advice of experts is pretty clear. Apparently, Doug Ford just doesn't want to spend the money to implement the measures that will support people and help us get through COVID-19's third wave quicker. And it's, it just shocks me that they have to bat this around hour after hour after hour after hour when the recommendations have been clear, and they've been clear all the way along. But again, this Conservative government doesn't want to spend the money to keep people safe, to implement measures that will prevent the spread of COVID-19 and help us to get to a place where we have hope again for the future.
Follow-up?
That's all from me. Thanks.
Next question comes from Laura Stone at Globe and Mail. Please
Hi,
go
Laura.
ahead.
Hi, Andrea. I guess I'm just wondering, do you think that that this should have, I guess I'm just wondering about the province-wide factor. Like, do you think that these measures should be targeting the province? Do you think they should stick to only the hot spots? And do you think there was a way to deal with the rising numbers that did not involve closing businesses further?
Well, I mean, there's a couple of things here. I mean, I think it's really clear that without, pretty basic travel restrictions, that the regional approach is not going to work. So if we had those travel restrictions in place, perhaps the regional approach would be something to think about. But from what I'm hearing from the experts as of today, is that ship has sailed, that it's too late now. And that's because Doug Ford didn't want to put the kind of measures in place that he should have. And my heart breaks for the businesses in this province. The ups and downs, the hope that they get, and then the dashing of that hope by this premier. It's put them in an untenable position. And as you know, many have already had to close their doors. And here we are, again, in a situation where the government's not saying that they're going to provide the supports that businesses need to get through, and they're sending mixed messages to everyday Ontarians. They're being told on the one hand, well, you got to stay home. You got to stay home. And on the other hand, they're being told, but you can pretty much go almost anywhere you want. So this is why we are saying, and why I'm saying, this is the same failed approach that led to the variants of concern taking off the way they have. And these are the very things that the government and that Doug Ford was warned about back in February.
Follow up. Do you think the government needs to change its vaccination priority? The Premier talked about some hesitancy among frontline workers. He talked about being shocked how many people in their 70s and even 80s haven't been vaccinated. What do you make of those comments? And do you think that the government needs to open up the categories further?
Well, I mean, I think it's pretty clear to everybody that this government's vaccine rollout has been sloppy, it has been slow, and it has been not well communicated. And there has been very little to nothing done to deal with the vaccine hesitancy issue. But we've been calling for some time for the government to start implementing postal code-based vaccination plans. We've been calling for mobile vaccinations for a long time, going into those communities that are hotspots where we know that workers have to go to work to pay the bills, and so might go to work with symptoms, or might go to work and be exposed by coworkers that couldn't afford to stay home from work. This is why experts have been calling for those paid sick days for such a long time. It's not an ideological issue. It's a public health issue, and it's a stopping the spread of the variants issue. Similarly, of course, with the vaccinations and getting the vaccinations paid for so that people don't have to, skip a potential appointment because it doesn't mesh with their work schedule. People shouldn't have to, worry about taking time off for a vaccine. They should get paid time off for doing that. These are the very kinds of measures that would clearly make a difference. And thus far, the government simply stubbornly refuses to take that very clear advice from the experts.
There are no further questions.
Thanks, everyone. Enjoy the long weekend.